morning. Saturday morning, 9:30. So that means it's time for Coffee with a Candidate. I hope you all are doing well. For those of you all tuning in, I am Ronetta Francis, and I am the candidate that is running for the Arkansas State Senate in District 1. And I am happy to be here with you all, and I appreciate each and every one of you tuning in today, and those of you all who have tuned in on a weekly basis. We began this weekly series about 4 weeks ago, maybe 5. I've completely lost track of time, to tell you the truth, when it became ever more important for each of us to practice social distancing and to ensure that everyone is doing our part during this public health crisis to flatten the curve, to stop, slow down the rate of transmission from one individual to the next. And so this campaign has taken on that mantle very seriously as it relates to all of our activities and fundraising and volunteer outreach and everything related to this. So this is our effort to stay connected with the community, to reach out to individuals, to do a check-in, to ask me questions, to talk with other members of the community to see how they're doing, provide resources and information as we all go through this public health crisis. As we're entering week 4, or we've just completed week 4, or we're in week 74, time becomes this kind of really abstract concept, right? I don't know if you guys are experiencing the same thing and you wake up and you're trying to figure out if today is Tuesday or Thursday or what day. But as we go through this each and every day, we get that much closer to coming through it, that much closer to being able to say we lived through it, we overcame it, and that much closer to being able to redefine what it looks like to be prepared for an emergency of this nature, and to ensure that we have representatives in the legislature and in government who are prepared and who represent us to the greatest extent possible. So you guys, I'm sure, have been keeping up to speed with everything related to COVID-19, coronavirus, the latest statistics, how it's impacting our lives day by day by day. Hopefully, many of you have had an opportunity to participate or at least apply for the Paycheck Protection Program that we talked about a couple of weeks ago that is now in full swing. If you haven't already applied and you're a small business owner, it's not too late. I believe that the application period is going to be open for quite some time, but the defined period for relief will be, it's already been defined. But don't think that if you haven't done it in these first, frenzied days that you've lost the opportunity. You haven't. Also, if you haven't filed for unemployment and you're in that category, please go ahead and take advantage of the opportunities, the resources, and the support that is provided. I think the number nationwide was over 6.6 million who applied for unemployment for the last 2 weeks. And in Arkansas, that number is over 139,000 in this last, total for this last week. So you're not alone, and we are all doing our part to help to make sure that there are resources and support available to help us get through this. So if ever there was a time that we're all pulling together to do what we can to help each other, to uplift each other, to empower each other, to support each other, to encourage each other, now is that time. And I just really hope that the spirit that we're feeling now, we don't lose that when the crisis wanes, that we don't lose what it means to look out for our neighbors, that we don't lose what it feels like to need support, to provide support, and to know that there are others looking out for us. So I just hope that there is that silver lining, that we're able to hold on to that and to carry that forward, not just in the short term, when this crisis abates, but day after day after day, that we treasure the opportunities that we have with each other. I think one of the things that has been made most evident are our social interactions, things that we may have taken for granted that we no longer have the opportunity to do at this time, that maybe we really treasure those even more going forward, and that we don't um, take advantage or disregard or just kind of not even really consider those things that are really, really the most important. So, thank you so much for joining us today. Thank you for taking care of yourselves. Thank you for staying home. Thank you for supporting um, our neighbors and family and friends who are on the front line, who are sacrificing themselves um, to help take care of the rest of us in the midst of this pandemic. Essential workers, healthcare workers, first responders, all of you. I say thank you for everything that you do every single day. And I just hope that it would be fantastic, wouldn't it? That everyone who's still out on the front lines, who's still providing services, that when this crisis abates, that you get an opportunity to have some downtime, that you get an opportunity to recharge and to take care of yourself and to fully heal and rest after this, because you've been going not only while everyone else has been, working from home, you've been going nonstop. You've been going above and beyond what you've normally done. And that's not gone unnoticed. And I pray that you have an opportunity to be able to do that. And because you deserve it. You really, really do. Mm-hmm. Speaking of individuals who are going, oh, did I do something? Oh, I'm sorry. Speaking of individuals who are on the front line and who are working to help to represent all of us here in Northwest Arkansas and in the 3rd Congressional District. The guest today, as you all have seen from the post descriptions, is Celeste Williams. And I'm going to bring her on now. She is running, like I said, for office to represent us in Washington, D.C. And she is one of the individuals that's on the front line now as a healthcare provider. And she's a mom, and she's a nurse, and she hopes to represent us in Washington. So I'm going to bring her on now, and we've got this really fantastic conversation, I'm sure, that you can imagine with what's going on these days. So I'm going to bring in Celeste in 3, 2, 1. Yes, it worked again. Y'all don't know how excited I am to be able to do this and for it to flow. I'm going to be a television producer if this other aspect of my life doesn't, quite pan out. Celeste, can you hear me?
I absolutely can.
Okay. Awesome, awesome, awesome. So welcome, 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 Celeste, to our weekly edition of Coffee with the Candidate. And I guess I should say Coffee with the Candidates. So I've got my shirt on. Celeste, are you wearing your campaign shirt? Let's see.
Celeste
We're
Williams.
each representing. How about it? How about it? It's so exciting. Things that I think has been tremendously surprising for me is the support from fellow candidates throughout this election process. It's been tremendous. You think that, the campaign, the political process is so competitive and so, just out for out. And it is competitive, but when we're not, like Celeste and I, we're not in a position where we're competing with each other. So not only is that like, okay, we're not competing, but we're supportive of each other. She'll ask me things, but I really go to her and I say, hey, what are you doing with this? How does this work? And she and her team have taken time out, literally, from everything that they're doing to just kind of walk me through some of the questions that I have, some of the, best practices that they're employing. And I just can't appreciate you, Celeste, you and your team, for everything that you've done to support Northwest Arkansas, to move us to the next level, to support other candidates as well. So thank you so much for joining us with Coffee with the Candidates.
Thank you
so
much.
Celeste, I kind of gave a brief overview. Yeah. Would you just spend some time telling the people, I sound like, who do I sound like? Telling everyone a little bit more about yourself and what you do and what office you're running for and why you're running.
Sure. So, as Ronetta said, I am Celeste Williams, and I am a family nurse practitioner, and I am running for U.S. Congress here in Arkansas's 3rd Congressional District. And that's not just it's sort of the northwest corner of the state, but it goes from Fort Smith all the way up along the top of the state, and then all the way across over to Bull Shoals, and then comes all the way down to Russellville. And it's sort of this giant upside down horseshoe. So I am running for Congress because I don't think that you should go broke just because you get sick. I think we have
Mm,
to have a world class education system, and workers need to be paid a fair wage. And so,
mm,
a lot of my impetus for running was just seeing the struggles of everyday people in the exam room in clinic when I would see them. So many of the problems they faced were not things that I could write a prescription for and fix. And
mm,
so, I think that it is really important to create justice and equity within our communities. And I think that you get there by making sure that all people have access, and not just access, but quality education, quality health care. And you have to have a good paying job to be able to put food on this table and support your family. And all of us want to be able to succeed where we are. And near and dear to my heart, I grew up in a very rural community. I want to make sure that we don't leave rural communities behind.
mm, mm. That's an important aspect to the campaign. As you were talking, the focus on education, the focus on health, the focus on good paying jobs, we all have that in common. Those are similar platform issues for me as well. But one of the things I think that's really unique is really bringing home the bringing to the forefront that we cannot leave our rural communities behind, and particularly in Arkansas, I don't know what the distribution is, rural communities versus urban, but we've got a lot. And we need to make sure that their voices remain to be heard and that they have representation and have access to the types of resources, support, and other services that those in the much more urban or kind of, much more heavily populated areas experience. So I'm so grateful that you have that piece as an additional part of your platform.
Thank
So
you.
as a healthcare worker and on the front lines during this public health crisis, how are you navigating, providing services to the public, protecting yourself and protecting your family?
So, we have certainly moved, I work in primary care. And so it has been a tremendous amount of change that we've gone through over the past few weeks. I went from seeing patients in person in clinic with every once in a while an e-visit, or where someone sends in a request and sort of a list of their complaints and messaging back and forth to get their needs met, to now almost entirely doing e-visits, video visits, telephone visits, and so I feel like my risk is really low right now
Okay.
because
Okay.
so few people are coming into the clinic. Of course, just to protect staff, if I'm not sitting in my office by myself, then I am to be wearing a mask throughout the clinic because we none of us know if we are asymptomatic carriers. And
Mhm,
so we want to make sure that we're protecting our coworkers so that they don't get sick.
mhm,
I worry a lot more about my husband who works in the ER. And,
mhm,
a lot of my friends, before I did family practice, I worked in the intensive care unit. And so a lot of my friends are in the healthcare industry, and a lot of them work as bedside nurses or in an administrative role within various hospitals in the area. And so I worry a lot more about their risk and their health. And really, I probably worry less about their health as I do worrying about the emotional trauma that, like, an ICU bedside nurse will face if we have a high death rate and a high
Mhm.
number of people
Mhm.
that are admitted to the hospital. And if we were to run out of supplies and those
Mhm.
kind of things, it I do feel a fair amount of guilt for not being there with them,
Mhm.
because I feel like that's what our training is. That's what
Mhm.
we do, is we show up when there's a crisis.
Yeah.
And I know that I'm doing my part in a different
Yeah.
way, certainly
Yeah.
the needs of people in the community in a different way, but I do think a lot about my friends in the ICU and ER who are really doing
Mm.
the hard work.
Mhm. I think you raised two excellent points. One, we're all doing our part, and you're doing your part as well. So please don't feel guilty about the work that you are
I
doing.
am guilt motivated.
I understand it's kind of ingrained in some of us from time to time, but when you listen to the news reports and you see how you see the pattern and the behavior of the spread and transmission of this virus, the predictions are that Northwest Arkansas and Arkansas in general will experience a spike in the next week or so. And so there may then be an opportunity to do more in your particular field to provide additional support for others or relief for others in the healthcare field as the number grows. Hopefully, we'll do our part individually to make sure that number doesn't get as high as it possibly could be. But if we are living through the time that other communities have lived through, the spike is headed our way, as I understand. And so, what can we all do to prepare for that without causing panic, without causing alarm? How can we calmly, rationally support each other, prepare without making runs to the grocery store and buying up all the again toilet paper and paper towels or Fritos scoops, which I was surprised was out of. I'm like, who's making a run on Fritos scoops? That's my favorite snack chips. But what would you say we should be doing here to prepare?
So, the number one thing that we need to do to help prevent the spread of the coronavirus is to continue to stay home, to socially distance, to wash our hands frequently. I went to the grocery store, which I had not been to the grocery store in probably 4 weeks. I had
Mm,
not been since this started. And so I went yesterday. And I pulled up, and the parking lot seemed somewhat full. I didn't go to like a large grocery store, but it was a smaller place. And I wore my mask in, assuming again that I'm an asymptomatic carrier. I don't want
mm,
to live with the fact that I might pass the virus on to somebody else. And so I want to protect my neighbors. And I walked in, and people were doing such a good job of
good.
maintaining distance between one another. And I would say more people than not had on a mask as well. And, I think those are the things that we can all do to do our part. We don't need to go to the grocery store every single day.
Mhm.
We can make planned trips and get what you need and then stay home. And really, I think it is a time not only just having stocked up on things, but also to support one another
Mhm.
mentally, because I
Mhm.
think human beings by nature crave connection and
Absolutely.
relationship. And
Absolutely.
so I think it is also a time that we can really reach out to friends and family members and check in on our neighbors and make sure that they're doing okay.
Right,
And the
right.
other thing I think about right now is, this is Easter weekend, and
Yeah.
that's generally a time of family
Mhm.
and get together. And, this isn't the time to have a big family gathering. And so it's coming up with creative ways that we can make sure that we continue to have that sense of connection, but do it without the physicality of being together. Like my family, I'm making a dessert for Easter Sunday, and my parents, who live about a mile away from me, are making the rest of the meal. And so we're going to do a food swap. And
Okay.
then we're going to go home and we're going to do a Zoom conference
Oh, that's funny.
and have dinner together,
Yes.
because, especially with both my husband and I working in healthcare,
Mhm.
and my parents are older.
Yeah.
Um,
You can't take
it,
that chance. You can't take that
no,
chance. Yeah.
not.
I've seen suggestions of families having Zoom bingo, not bingo, Easter egg bingo.
Yeah.
Or I know, and I personally have leveraged Zoom to and other platforms, Facebook Live and others to connect with family and friends. Some that we've been in contact with all along, and some that I just haven't had an opportunity to chat with. I reached out specifically and to several of the ladies I graduated law school with, and we keep up with each other individually from time to time. And I was like, no, now's the time for us all to come together. So we had our own legal gals chat, and we sat on the computer for almost 2 hours, and we caught up with each other, we laughed, we shared, we cried. And for that emotional piece that you just mentioned, it was so important.
Hmm.
It was so critical. And quite frankly, it's not something we would have done had we not been in this situation. So it really is forcing us to be more creative, to satisfy that kind of social need, and
Hmm.
to reach out to each other. And you had mentioned earlier about the ICU nurses and the emotional strain that they are going through, and you see the news reports of how they're helping patients transition, and how kind some of the nurses are to reach out to family members and holding up the phones so that they can FaceTime like right before their final moments. And when I see those news reports, I'm just overcome with emotion about how challenging and how much that must weigh on those healthcare professionals. I know there's a certain amount of distance that you have, but just as a human being, just as a caregiver, that has to take its toll. And so, to your
Absolutely.
point, we need to continue to lift up those in healthcare, particularly those that are providing services, and pray that they don't become callous, and that they're not overstressed. And I know already that they're overworked. That's not even a consideration, but just that their hearts not become hardened, and that they are somehow enabled to have the strength and the grace to continue to provide the services that their patients need in a way that also comforts those who can't be with their loved ones at that time. The families would love to be there,
Yeah.
to be holding hands and to say their final words to them, but they're prohibited. And so that's it's hard on so many aspects. So
I think that is probably one of the most deeply painful things to think about, you know, especially if you think about if it's your family member.
yeah,
I can't imagine them being alone in that
yeah,
time.
yeah,
And, having been an ICU nurse for over a decade prior to doing what I'm doing now, like, I know that there's probably a nurse that will hold their hand and be with them
hmm
in that
hmm
time.
hmm
But, it's still, you know,
so hard.
you want to be there yourself as their
Yeah,
family member.
yeah. So in addition to this pandemic, uh, impacting individuals, it's also impacting every aspect of what we do. That's why we're doing this live from a political standpoint, but the impact it's having on the economy is very well documented. And particularly small businesses are in a crunch. Small
Mhm.
businesses, entrepreneurs, independent contractors are really, really feeling the crunch. And I know that there are some stimulus package funds available, particularly for small business, and they're implementing ways now for um, solo practitioners, independent contractors, those individuals who are self-employed, to also be able to partake or at least have access to some of that relief funds. But for those small businesses that are still open, who haven't shuttered their doors, who haven't released all of their employees, and are still striving, they're also being very creative about how they offer their services. And some of the things I think we could do to support them would be, knowing, first of all, you got to know your community, right? You've got to know where those small businesses are. You got to know, what services they provide. And I almost feel certain that a lot of them are having online options as well. Consider those types of services and support when you're placing an order for something, or because the online shopping has just gone through the roof, right? So how else, Celeste, can we support small businesses as individuals outside of what the government has done? What else can each and every one of us do to support small businesses during this time?
So I personally have chosen different small restaurants in my community that are still open to, I'll get takeout a couple of days out of the week since I am financially in a position that I can continue to do that.
Mhm.
Um, and make sure that I'm supporting them in that way. And then, it is a challenge
Mhm.
because, our whole what we need to be doing right now is staying home. And so there's not, other than food, there's not a whole lot that I need outside of my home right now.
Mhm.
But just thinking about, servicing the people of our community. um, I talked to a lady who worked for the Samaritan Center recently, and she
Mhm.
talked about that. Normally they serve about 1,000 people in their two locations every week, and this was just a couple of weeks into being more
Mhm.
quarantined.
Mhm.
Their number of people that they were feeding was almost 3 times as high as normal.
Wow. Wow.
So many families would come in, and she said, you could tell that they had not experienced this before and
Mhm.
didn't really know how things worked, and like just sort of that look of shell shock, and not
Mhm.
like
Mhm.
having to ask for help just to feed your family. And
Yeah.
so, while I think whatever small businesses are open, if we can all individually support them, that's wonderful. But I think we also need to think about those organizations in our community that are helping to provide food for those
Mhm.
who have lost their
Mhm.
financial means of supporting
Right.
themselves. So,
And there are several lists available of uh, volunteer opportunities within the community, whether actual physical service or financial support. And they are listed, I know, on both the Bentonville um, city webpage, as well as the Rogers government, the Rogers city's webpage, City of Rogers. So for those of you all, particularly in the Northwest Arkansas community, who have the interest, the desire, and the means to provide additional support for your neighbors, check out each or both of those pages. They're not limited to organizations that are in Bentonville and Rogers. They are very inclusive and include all of Northwest Arkansas in this particular area. So check those out. And some of them are part of national organizations. So if you're tuning in and you're not in Northwest Arkansas, those national organizations have an affiliate in your town as well. And reach out to them to see what it is that you can do to further support your friends, your neighbors, your family.
but I will say, back to your original question, there was provisions in the CARES Act for small business owners to apply for a loan that could help them sort of float their business along, that as long as they don't lay people off, then they can have those loans forgiven. And
Mhm.
then also there are provisions for a longer term unemployment for people to be
Mhm.
able to file for that. So,
Mhm. And there is a unique group of people, which I happen to fall in, where you're self-employed or you're a small business. You're so small that it's just you, right? And
Mhm.
so it's a unique perspective or unique position to be in, because it doesn't necessarily fall within the small business, even though you are a small business, and it's not quite you're unemployed. So the latest um, system, or how they're working through how to cover those folks who kind of fall in, right there in that middle spot. And so for those of you who are out there who are also in that middle spot, who are trying out, being an entrepreneur, not trying out, but you are an entrepreneur, and you're self-employed, and you've been, following that particular dream, and you don't fit into either of those categories. There are some provisions, and they're just working through the mechanics, the logistics of how to, because I think we all are covered, but they've got to find the right process to ensure that, whatever the access is to that relief is covered. So we've got a fun question. Someone asks, "What have we been binge watching on television during this isolation period?" And Celeste, I don't know if you watch television a lot or television, but I'll let you go first, and then I'll share my answer.
I am generally a person who struggles to sit still very long, and so I have not watched a whole lot. I will say I did get subscribed to Hulu so that I could watch the Hillary documentary, and I was not ever like a giant fan of the Clintons, but it is so good and it is so fascinating. And I don't think that you have to be like a diehard Democrat to appreciate their life story and how well that this documentary was done. It was really, really interesting.
You mentioned that one to me, so it's on my list. I haven't gotten to it yet, but it's in the rotation, as they say. So no Tiger King. You didn't watch Tiger
I've
King?
not been watching that. My husband has been watching that, but I have not. I did listen to a podcast series on that a year or so ago, and so I
Okay.
know the story, but no, I have not watched that.
Wow. Well, so in addition to having, being a lawyer, I have my master's degree in clinical psychology and worked in the field for several years before I went to law school. So I still have this fascination for psychology, human behavior, and just really, really, really interested in people and how they work and think and behave. So I will confess, I watched the entire series on Tiger King. I found it fascinating, just
Yeah,
utterly fascinating. And that's just, it, I fell into it. I found it fascinating. Whether I can say I enjoyed it, but I watched the entire thing,
yeah.
and I have drawn my own conclusions about what happened to Carol Baskin's husband. I don't know if you know about that, but we'll sip the tea. But the other program that I have watched and hold firm to and just really do enjoy is Ozark. And Ozark, they just released their third season a week or so ago. And it's set in the Lake of the Ozarks in Missouri. And have you seen that one, Celeste?
Oh, I am such like I know that I live in an alternative universe because I just don't watch that much TV.
Yeah, I get it, and there isn't much that I do watch, but that particular series is riveting, and the writing is so well done, the acting is intense, the storyline it's just very, very compelling. So it's unpredictable. It is full of just about every human emotion you could possibly have, and it's fantastic. And I finished season 3, and I'm looking around the corner for season 4. I just it's is that a term for addictive? I don't know. I'm not going to say I'm addicted to Ozark, but I love it. I love it. And Shelly, you agree. Thank you, Shelly. She's got my back. She said yes to Ozark. But and Kate Schaefer is co-signing on your review of the Hillary. documentary. So
I
thank you
think
guys so much for joining us and who is that? Casey. I see. Yeah, I may not be seeing the question. So is there another question? I'm sorry. Let me spend a little time and kind of run through. Um, Philip is sharing the data on the expected peak for the coronavirus here, and he did share a link within the stream here. So any of you who are interested in knowing specifically what to expect as it relates to the peak for the coronavirus here in Arkansas, Philip has kindly included that information here within his thread. So feel free to explore that. And thank you, Philip. I think we've all become so, data is important. Facts are important. And it's really critical to follow the facts and make sure that we're educating ourselves about what's happening around us. Um, let's see. What advice would we give to young folks who have a passion for public service? I see that question. Thank you, Tura, for that question. I hope I pronounced your name correctly, Tura. So if you have a passion for public service, what advice would you give?
Are you okay? So I would say I would definitely get involved where you are and start locally in your community. And find an organization that represents your values and then really get involved and get active. And I think, I often say that, I think sometimes we feel like we don't know enough, we're not enough, we don't have enough experience to do something. And I always challenge people to say that you are enough where you are right now. You can get involved and you can make a difference. And so, whether that is finding a community organization, a local political organization, a campaign to support, any of
Mhm,
those kind of things, you can get involved. And,
mhm,
what you don't know right now, I am certain that you can find some people who can mentor you and help you
absolutely.
learn what you need to know.
Mhm,
And, speaking from a political perspective, it's certainly not rocket science.
yeah.
It's just talking to people and, you figure it out as you go.
It's true. That's true. I think the critical piece is, where does your heart lie? Where is your passion? What are some
Absolutely.
of the issues that you want to have an impact on? So, with that being the first consideration, whether it's education or healthcare or children and literacy or food or providing, ensuring food security or the environment or or pets, whatever your interest is, if you Google that and you say, how can I, you know, volunteer or support whatever that issue is, you'll have a whole list of organizations, ideas, and you can be creative all on your own. I've just marveled, particularly at young people who see a need and start something. 7, 8, 10, 15, no matter the age. And they make such an impact, whether it's saving their lunch money or donating other things that they have within their own possession, asking others to do the same. It can start very, very small. So whether you're a part of an official organization or you see a need that you want to address yourself, either one of those, just get started and make sure you're feeding that passion to serve whoever it is you feel called to serve, and you'll be fine. And you'll be fine. Celeste, one of the things that I was looking through some of the comments when you were speaking, and I introduced, had you introduce yourself, give a little bit about your background. And so we've got this kind of crossover going between our two campaigns because Celeste invited her viewers and supporters and donors to check her out during this time. And I did the same. But there may be some of your people who've been following your campaign who may not know me.
Hmm.
And so what I didn't do was to kind of share a little bit about my background, where I've been, the work I've done, why I'm running for office. So thank you so much for that question. I can't see who brought it to the attention, but thank you so much for that. So I have been in the Northwest Arkansas area for a little over 13 years. My background is I have a very strong legal background. I've practiced employment law for more than 20 years, 10 years with the Equal Employment Opportunity Commission, and another 10 years of legal and ethics experience in a corporate environment here at Walmart. My last role was Vice President of U.S. Ethics and Employment Compliance. So my background has really been focused on advocating for those who are underrepresented, really fighting to ensure an equitable workplace, an environment for all people to thrive and to succeed, and drafting, creating, enforcing policies and procedures to do the same. Since leaving Walmart, I started my own consulting firm, Francis Dynamics Consulting Firm, and it's a consulting group. I should get it right. And my husband asked me, "Group? Who else is in the group?" It's just you. I know for now it's just me, but you have to speak these things into existence, right? So with the consulting group, I really focus on executive coaching and leadership development. And the name of the program that I've created is called Bloom Where You're Planted. It's a mantra of mine, and I've written a book of the same name. I speak on those topics very frequently at developmental conferences, leadership programs, and things of that nature. So there's more information on Bloom Where You're Planted. But what I think is most important about why I felt called to run for office is while I'm also very business minded and have lots of attention for fiscal responsibility, I also have a very strong heart and very compassionate about social issues, about how we care for and protect and serve the community. I grew up in Birmingham, Alabama, and just 2 years before I was born, the governor of Alabama stood in the schoolhouse doors of the institution that I would later attend to declare that African Americans, Blacks, whatever the terminology you feel most comfortable, that we weren't welcome. His phrase was segregation today, segregation tomorrow, segregation forever. And if that were the end of the story, we would be having a different conversation right now, but that wasn't the end of the story, primarily because of a Vivian Malone Jones, a female Black woman who had to sue, had to fight to get into the University of Alabama, to pursue her education and to pave the way for others, including myself, to be able to attend the University of Alabama, to graduate, and then continue to give back to the community. It's important and always has been an important aspect of my life to give back to the community, to look out for others, to speak for those who do not have a voice, and to ensure equity and equality across the board. My goal for being in office is to be a voice, to give Northwest Arkansas a choice as it relates to their representation, and to ensure that I am providing representation for all of Northwest Arkansas, not just a select few. And the response and feedback I've gotten from folks has just been overwhelming, because they recognize within this campaign an opportunity for change, an opportunity for growth, an opportunity for progress, and how Northwest Arkansas can continue to lead this state on so many other levels, and politics and its representation being one of those. So I feel a tremendous responsibility with this campaign. It's not even about me. It's about the people who live here, the people who want to see things move forward, who want to see a difference, who want to see a change. And that's what I represent. So let's talk about those platform issues as it relates to education and access to public health, and the pricing of prescription drugs and good paying jobs, a diversified economy here in Northwest Arkansas. We share those same platform issues. But what's really most important is what's important to you, what's important to the people of Northwest Arkansas. Those issues are the ones that we will be advocating for, hearing your voice, knowing what your pain points, what your issues, what your concerns are, what's driving your heart, and being able to advocate on behalf of those as well. So I hope that answers your question about why I'm running and what I hope to accomplish. It's been a tremendous opportunity thus far. I've been felt enormously embraced by the community, and I'm looking forward to bringing home a victory in November. Right, Celeste?
Yes, completely concur. And I wanted to just say, I am so proud to be part of, you know, all the amazing women in the area who are running for office right now. I always take to heart, Madeleine Albright had a quote. So forgive me, it's a little harsh, but she said there's a special place in hell for women who don't help other women. And I think a lot of the reason that I chose to run for office, beyond wanting to really represent everyone within the community, not just one political party, but really work for everyone so that we have a better
Mhm.
community and stronger families and everyone has a chance to succeed. But I also wanted to be able to help support all the other wonderful candidates in the area as
Mhm.
well. And
Mhm.
so
Mhm.
I personally feel very proud of you and what you're doing and what you've accomplished so far. And I'm really
Mhm.
excited to see where you go from here.
Thank you. Thank you. It's a team effort. It's a team effort for all of us. And so, as like minded individuals, we continue to support and uplift each other. Um, and I think you would represent us tremendously well in Washington. And I'm a full supporter of yours as well. So I'm trying to think if there was anything. Well, we had a few issues as it relates to the stay-at-home order and the voting by mail that are rather political and could be somewhat divisive. But if we have just a few more minutes and if folks are interested, I know that as of yet the governor has not issued a statewide stay-at-home order, and folks are kind of reacting to that. I have my opinion about how we can, even if he hasn't issued one, we can still do that.
Yeah.
We can still take our own personal responsibility to protect ourselves and to protect our neighbors and our family members. Celeste, what's your take on that?
So I know the governor has felt that a targeted approach would work, and I will say that looking at the data, we're not seeing a big spike in COVID cases. But I do think that the reality is that is because a good percentage of us are staying at home and are really
Mhm.
doing our part to social distance. And I am an eternal optimist, and I do feel
Mhm.
hopeful when I see that those numbers are not as bad as what we thought that they might be. But I
Mhm.
think that we can't
But we shouldn't take
have
that
a
for granted. Mhm.
absolutely not. We
Mhm.
have to really, like, it is that to me means that we need to continue to really buckle down and
Mhm.
stay at home and
Mhm.
really that social distancing works and that is the course that we need to continue and we can't let off of that and try to get back to a normal routine. We have to do our part to stay home.
I agree. I agree. So, to whomever asked the question, whether or not he mandates it, we know it's the best practice for us. And until this pandemic has really been is really under control and has really ceased and passed us, I think that's our responsibility. That's our obligation to do so. So along those lines, when the CDC recommended not going out in public, and you mentioned the masks, my cousin, who is a physician, last week recommended, and just kind of advocated that we leave the surgical and hospital masks for those in the healthcare industry, and not to buy those up. Use homemade masks, scarves, things of that nature. So I'm not a sewer, but I did see that the Surgeon General had a video on how to make your own mask without sewing. And I did so, even though I did kind of tack down the inside. Don't look at that, it's not cute. But it's a scarf that I folded in half and then folded again and looped. I didn't have rubber bands, so I used ponytail holders. And uh-oh, now I have my mask that usually fits better than this. Uh-oh. Covers my face, covers my nose. I made one for each member of the family while they're here to help at least stop the spread. right? Celeste, when you're talking about sneezing or coughing or just even breathing on others out in the general workspace. So, I mean, in the general public. So we're not going out often, but when we do go out, I ensure that we have our mask and our little gloves too if we need to. So everyone's doing their part. And Celeste, I appreciate you joining us today. And any final words you'd like to share with everyone?
So I would just like to echo the gratitude of being able to participate with you. And then for those of you who are watching, I would love to ask that you like us and follow us on social media, help share our message. You can go to our website, celestewilliamsforarkansas.com, and you can sign up to be a volunteer. There are certainly opportunities that don't require in-group meetings,
That's
such
true.
as banking and just being an advocate on social media to get the message out. And then
Awesome.
if you have the means, I know that it is a difficult time financially for a lot of people, but if you can, it would be great if you could contribute financially to the campaign.
Right, right. That's
Ronetta
amazing.
as well. You can do all of those
Yes,
things for
yes.
her.
You can see the scroll across the bottom about information on how to support my campaign, either through volunteering, getting additional information, and or how to make donations directly to the campaign. If you're interested in staying in touch with the campaign, you can drop us your email address here in the thread, or you can go to ronettafrancis.org, and similar to Celeste, you can identify what areas you'd like to volunteer in. You can get more information about the campaign. And if you're able and feel willing, I mean, if you're willing to, you can also make a donation as well. One of the ways that we are being very creative as it relates to continuing the campaign in this particular time is using, more technology. And so we're doing virtual phone banking as well. But right now, during our phone banking and calling our neighbors, we're not calling or asking for donations. We're doing wellness checks. So if you are interested in volunteering with the campaign and checking in on your neighbors, we're having a training today at 2:00. You can not text, you can drop us your information here and we'll get you the information on joining the Zoom call to prepare you for making those calls to our neighbors. So volunteer call at 2:00 today. If you're interested, please drop us a note here, go onto the website or to our Facebook page, Ronetta Francis for Arkansas. Again, thank you so much, Celeste, for your time today. Thank you, each and every one of you, for joining us again this week. I hope that you have a safe and healthy weekend and enjoy this time with your family. Thank you.
Thank you.
Mm-hmm. Bye-bye. We're clear. Can you hear me?
Mm-hmm. It still says live.
Oh, it says stop. Stop streaming.